he only was faded, quote unquote, for a day. The brain is doing what it knows best that he has done for years. Hey everybody, welcome back to the channel. This is Dr. B Addiction Recovery. The discussion today will be about a case of mine, and it is labeled Benzodiazepine Relapse Case, a glimpse into the black hole of addiction and relapse prevention. I'm hoping this is helpful because I think if you really understand what addiction is, for example, versus physiological dependence, it really feeds into understanding what relapse prevention is, what you need to do, the chronicity of this issue, and the complexity and ugliness of some of its aspects, and a glare into it hopefully gives you some tools to move forward. I feel that my job and my role here is to take potentially complex concepts or data and distill it down in a way that's digestible for everybody. So let's get started. In this particular case, I am going to defer describing to you or reporting to you some of the other mental health diagnoses that we're working through with this young man. In addition, I'm changing some of the demographic labels just so we make sure that the person is not identifiable. Little background. This is a young man in his late 20s, lives in greater Los Angeles at home with his parents, that was brought to me because they had concerns with addiction, and I didn't get much more than that. As it turns out, he goes on these pressed Xanax runs, right? He holds out for a few days at a time, and then all of a sudden he explodes and he goes out and buys a whole bunch of pressed Xanax, and he essentially fades out for 1, 2, 3, 4 days and then comes back to life almost relieved, almost a rebirth kind of a thing. If I were to describe the particulars of this case and how it was presented to me. What is going on is that in his background, he's got some minor gang affiliation. He has had GSWs, gunshot wounds. He was hospitalized for severe trauma to the chest and abdomen with exploratory laparotomy, which can cause anxiety, post-traumatic stress, a certain degree of vigilance. But this young man was extremely suffering from social anxiety and to some extent paranoia that every time he goes out, who's looking at him. In fact, he deferred going to school or getting some sort of reasonable job, always looking over his shoulder. Now, to get into any further diagnosis about those issues, I'm going to defer, except to say that he was in a heightened sense of autonomic anxiety and tension every day. And these Xanax runs were a sort of a relief outlet for him. Mind you, extremely dangerous. We're talking about pressed benzodiazepines, and these can cause overdose quite rapidly because the dosing is often off. So we did stabilize this young man, and for several weeks he was feeling much, much, much better. He did have one run at one point, which I didn't see him when he had returned to the clinic, but we stabilized him on 1 milligram of Clonopin 3 times a day, although he always wanted more because he said everything was not mitigated. Abilify 10 milligrams once a day. And during these early periods, we usually try to adjust the dose so that he can really forget. And it takes a little bit of work because what you want to find is that spot where they're not over sedated or intoxicated or having sort of a euphoric day versus feeding into the addiction and at the same time keeping the person active so they can progress with their life. On this particular presentation, he had been on a really solid run with us for a few weeks, and he said, "Look, I messed up and I relapsed." I quickly reminded him, "You had an episode of use, describe it to me." And essentially what had happened is he did go get his pressed Xanax. He only was faded, quote unquote, for a day, got right back on his horse, got straight, and came into me, which is fantastic. That's exactly what I want to see as we progress through the chronicity and the ups and downs of this, eventually adjusting their medication. But what I did do, as I said, stop and tell me the detailed anatomy of the day that you used. And here was the key question: were you craving that day? And he said, not really. And I said, well, what happened? One of my quote unquote boys called for me to pick him up some pressed Xanax. The background of this is usually when one of his boys calls for him to pick up some pressed Xanax, the deal is that he gets a large cut of that. So when his buddy called, right, what he did do, it was just almost instinct. And he said, sure, no problem. I said, did you have a plan to use at that moment? He said, no. As the day progressed, he went along and picked up the Xanax, came back. Now, at this point, and then he grabbed 20 bars of Xanax, of the pressed Xanax, and he just got loaded for a day. So I really dug into that and I said, well, tell me what happened. He said, well, then at some point, once I kept the Xanax, I said to myself, well, I'm going to use this over the next several days. Well, he inhaled the whole thing over the next 24 hours. And then he got back on his horse, started taking the medication we gave him from his parents, and he showed up to me. What happened there? What does this tell us? How does this educate us? Well, it tells us quite a bit. It tells us a lot about what addiction is. The minute his friend called, because he is so close, so proximal to the time where he started his recovery, the central nervous system, higher cognitive functions, evolutionary mechanisms that are built in for fight or flight that have all been plugged into feeding his addiction took over without him realizing it. The minute his friend called and asked him to pick up his Xanax, the brain had already plugged into a routine that he had been used to and he had done so many times before. He may have not known it at that second at a conscious level, right? But because he's not far enough into recovery time where he has built new neural connections, new neural networks, new systems, right? The brain is doing what it knows best that he has done for years and built those connections and systems. It already went to work. The brain already knew, whether he was aware of it or not, that he's going to pick up and he's going to take those 20 pills. Somewhere along the way there, he's like, whoa, what's going on here? And tried to slow it down, said, well, I'm going to take this over the next few days. No. His friend left. He inhaled the Xanax. And then he shows up to me. What this tells us, and what I try to teach him, as you guys often hear about, hey, when you drive by that 7-Eleven where your dealer used to be, you might start to salivate, right? These are certain parts of the brain, the reward circuitry system, that has already been recruited for a survival mechanism falsely to make it to feed in that. This is why addiction is so complex, right? It's much more than detoxing you. This is why it's much more than a short period of time. It is chronic in a sense that it takes quite some time to rebuild neural networks so that when that friend calls, you don't kick into almost the evolutionary fight or flight system, because that system over time, over training by the way you live and the behaviors you engage in during your recovery, will mitigate the issue by, at the best case scenario, hey buddy, how are you? Look, I don't do that anymore and I don't want to pick it up for you because it's dangerous stuff for you as well. Have a great day. Peace. See you later. And that's what addiction is, right? That is a very high level of cognitive engagement in addiction, much, much, much more than what you usually hear about the reward circuitry at the more primitive level, nucleus accumbens. You often hear about that dopamine release. We are talking about the neocortex being involved and engaged and recruited into a mechanism that your brain thinks is normal. And so part of recovery is understanding that, and also understanding that's not the end of the story. As you engage in a different lifestyle during recovery, you will recruit new neural networks and systems so that in the future, every single day that you go in your recovery, in your sobriety, you will be recruiting new neural networks, new systems, and capacity to cope with the stressors outside. At this point, with this particular young man, we're first trying to mitigate his anxiety and some of the paranoia that he has so he can have tools, so he can focus on building tools of living every day. So instead of him getting his Xanax out there, we're trying to use Klonopin. We do a cross tolerance, long acting, less likely to be abused, with close follow up and weekly visits and the ability to deal with any sort of other issues in terms of access one that's going on and follow him closely. And once he gets comfortable in that zone, we want to push him into living, whether it's going to school, whether it's working with his father, whether it's rebuilding new relationships with old folks that need to be rebuilt, or building new relationships out there in the world. As these things occur, little by little, neural networks will be rebuilt. This is very important to understand as you proceed on your way to recovery and sobriety. And it's hard. Nobody said it's easy. And that's why it's really critical when you hear, your counselor or other mental health professionals or your medical doctor saying to you, avoid person, place, thing, places you've been to. This is why, because and you want to do this for as long as you need to, or possible, or even forever. Who cares? But that time that you're avoiding, you are actively building and recruiting new neural networks. The young man is doing really well right now. We have done some changes in his dosing, and he's extremely comfortable where he's at. And let's all wish him the best of luck. He's a good kid. Thank you very much for joining me. If you do like what you hear or you enjoy it, please subscribe. Please press the like. And don't forget Patreon. We do have Patreon accounts and membership accounts for as little as $3 a month. Have a great day. Talk to you soon. Peace.